Hello guys, today we are continuing with anatomy. I believe you have seen my first video. Today this is a continuation, okay? So we have explained the bones in hand. Today we are moving with muscles of hand. In our hand there are two types of muscles, extrinsic and intrinsic muscles. From the word extra, like it's from outside, something like that. So extrinsic muscles are the muscles which are not present here. So they are coming from other surface. And intrinsic means they are already present here. Okay, they will be already present here. We have 20 intrinsic muscles, okay, and 2 extrinsic muscles. Let's continue. Two types, extrinsic and intrinsic. These are 2 in number and these are 20 in number. Okay. So first go through extrinsic muscle. I told you there are only 2, right? They are FDS and FDP. FDS is flexor digitorum superficialis, and FDP is flexor digitorum profundus. See, superficialis means the superficial muscle and profundus is Latin deep, right? So flexor digitorum profundus and flexor digitorum profundus, the 2 in extrinsic muscle, they are not present here. So what is the origin? Where is the origin of these 2 muscles? They originate from lateral epicondyle of humerus. I told you extrinsic muscles, they are not present in hand, they are coming from other surface of humerus. There is a structure for humerus, right? That is like epicondyle, this structure. So from here these muscles will originate and innervate here, okay? So flexor digitorum superficialis and profundus. Here itself I can mention you the function. See, flexor, it will be flexion, right? Flexion of what? This flexor digitorum superficialis will innervate proximal phalanges. No, we have in earlier video I explained what is this. Proximal phalanges. Proximal here means in some MCQs you can see first phalange, middle and distal phalange, or proximal, middle and distal. Here proximal doesn't mean only proximal, it means first and second, or first and middle. So proximal include first and middle. So flexion of proximal phalanges. These phalanges are controlled by flexor digitorum superficialis, okay? And here it is deep, right? So it is for distal phalanges. Deep is for distal phalanges. Clear? So that's all about extrinsic muscle. So muscles of hand are of 2 types, extrinsic and intrinsic. Here we discussed extrinsics. There are 2, FDS and FTP. They originate from humerus. Okay, then superficialis, it is for flexion of proximal phalanges, and deep profundus is for distal phalanges. Clear, right? Now we will move to intrinsic muscles. I explained you intrinsic muscles are 20 in number. Okay, they are 20 in number. There are 5 types of muscles. First is THENAR muscle, 4 in number. HPOTHENAR, again 4 in number. Lumbricales, very important muscle. Okay, lumbricales, 4. We have palmaris introsial, 4 in number. Dorsalis introsial, again 4 in number. So intrinsic muscles, they are 20 in number. So how 20? all these muscles make intrinsic muscle. Thenar, hypothenar, lumbricals, palmaris introsi and dorsalis introsi. Okay. Now we will study each muscles and their function. I told you here the muscle lumbrical, they are important, very important, right? This muscle, this is asked in many MCQs, this is known as writing muscle. The muscles which helps in writing, okay? Writing muscle. I'm adding one more thing here. Lumbrical, there are 4 in number. So 1, 2, 3, 4. 4 muscles will be there, right? So I told you in earlier video, our reference position in upper limb is from lateral to medial. Lateral to medial. So the muscles will be lateral 1, 2, 3, 4. These muscles, they originate from FDP. I told you earlier what is FDP. These lumbrical muscles originate from FDP. FDP is a part of extrinsic muscle. So from here they will give the lumbricals. Okay, clear. Now we will study thenar and hypothenar. Okay, see where these thenar muscles are present. Okay, see the palmar side. Here you can see in the pollicis, the upper limb. Okay, here you can see the thenar muscle here. Okay, and hypothenar, you see your little finger, the ulnar bone or ulnar, see this side. Hypothenar will be present here. Okay, thenar is here and hypothenar is here. Clear? Okay. Now we'll see the types of thenar and hypothenar muscles. So to remember this muscle, I have a mnemonics. A of P. Okay, A of P. Sorry. See, A of P. So what is this A for? I remember like this. My full name is Ashiq P. Okay. I remember like Ashiq of P. Okay, you can use your own. This is my mnemonics. A of P. So what is the first muscle in thenar? That is, I told you thenar is in pollicis side. Abductor pollicis brevis. In Latin, brevis means small or short. Okay, same side in hypothenar. I told you it is in little finger, right? So it is abductor digiti minimi. Minimi, the little finger, right? Abductor digiti minimi. Then second one, the O. O stands for opponents pollicis. Same here, opponents digiti minimi. Then the F. F is for flexor pollicis brevis. Here O is done. F here also same. Flexor digiti minimi. Okay. We have one more muscle here. This P is for that in hypothenar side. Okay, it is palmaris brevis. Okay, here also an exceptional muscle, that is adductor pollicis. Here we have written abductor pollicis. Here is adductor pollicis. Okay, so it's easy, right? How to remember the function? This is abduction. You know what is abduction? In our body in anatomy, abduction means going away. Abduct, away. Okay, abduct. Adduct means addition. So taking towards our body. Abduction means away and adduct means towards our body. Okay, so abductor pollicis brevis. for abduction of our thumb towards. Okay, here abductor, digiti minimi, same function. Opponent means to oppose, right? Flexor, it's flexion. Clear from the word. So it's easy to remember from this. Just remind A of B. Okay. So in many MCQs, they will confuse with nerve supply here. Okay. All hypothenar muscles, they are supplied by ulnar nerve. Okay. No confusion. All hypothenar muscles are supplied by ulnar nerve. So by heart this one. Hypothenar, I told you, this side little finger, right? Which bone we have here? The ulnar bone. So remember like that. The ulnar nerve will supply hypothenar, right? Then in thenar side, we have first three muscles. These are supplied by median nerve. Okay. I will explain this, the nerve supply. Just remember this. All first three thenar muscles are supplied by median nerve, and this adductor pollicis, they are supplied by ulnar nerve. Okay. So these MCQs, how you will get confused? What they will give you is the following nerves are supplied by median nerve. Okay, and they will give you abductor pollicis, opponent pollicis, flexor pollicis, and they will give a muscle from hypothenar side. So you must be clear cut. So you must be clear about both muscles. Or they will ask you all, like true or false, all thenar muscles are supplied by median nerve. It's not true. Okay, the adductor pollicis is supplied by ulnar nerve. Okay, keep in mind. So all hypothenar. So remember the hypothenar muscles, no confusion. They are supplied by ulnar nerve. And thenar, first three are by median, and others by, the last one is by ulnar. Okay, I will make it more clear. Now I will discuss the nerve supply. So in nerve supply, there will be both sensory and motor, right? Sensory and motor supply. Sensory and motor. This motor supply is done by two nerves, the median and ulnar nerve. Clear? Median and ulnar. That I explained you just now. Okay. So the median nerve, which all muscle the median nerve supply, the motor function? The first thenar muscle, first three thenar muscles. Just above I explained. And first two lumbricales. What is lumbricales? The writing muscle. Okay. These median nerve supply total five muscles. How many muscles we have in intrinsic total? 20, right? So 15 is left. All other 15, these are supplied by ulnar nerve. So it's easy to remember. What muscles supply median nerve? That are first three thenar muscles and first two lumbricales. So ulnar, all other 15 muscles. Easy to remember. Median nerve, they only supply 5 muscles, that are first three thenar and first two lumbricales. And ulnar, all other 15 muscles. So in MCQs, they will twist you, like they will ask many muscles, but you can rule out, right? You only want to remember the median nerve supply only 5 muscles. You can rule out the options. Clear? So this ulnar nerve, this is also known as musician nerve. Okay? I'm not a musician, but I don't know how. You know the guitar. Guitar is very famous in India. The guitar is, they will use this little finger. So it's working. It's working more. So the injury will be to the ulnar nerve. So it is known as musician nerve. Many musicians are getting this ulnar nerve injury or ulnar nerve sensational problem. Okay, the motor supply get damaged. Okay, and this is also known as, I told you here, see, only 5 muscles by median and all other 15. So the motor nerve of hand, it will be ulnar. It is giving most motor sensation, motor supply. So the motor sensational nerve of hand, what is that? Ulnar nerve. It is also known as musician nerve. Clear, right? So that's all about motor supply. Now we will see the sensory supply. This is our palmar side, right? Okay, and you know this is our radial bone and this is our ulnar bone. So always you will make mistake that here you may think there is radial nerve. You know this is the radial bone, so there must be a radial nerve supply here. But forget, there is no radial nerve supply in palmar side. In palmar side, no radial nerve supply. Okay, palmar. So what nerve will supply here? See, keep your hand like this. You can see I told you this is ulnar, right? So this one finger, the little finger and half, one and a half fingers in the medial side. It is supplied by ulnar nerve. Easy to remember. We have ulnar bone here. There will be ulnar nerve every time. And all other 3.5, the lateral 3.5 is supplied by median nerve, not the radial nerve. So forget radial nerve in palmar side. Okay. Now we are moving to the dorsal side. Don't turn your hand. Every time your anatomical position is this one. Okay. Medial is always ulnar and this is radial. Lateral is always radial. And see in dorsal side, here same. We have ulnar nerve here. So this 1.5 is supplied by ulnar nerve, same. Okay, no doubt. But in dorsal side, other 3.5, they are supplied by radial nerve. So radial nerve is only present here. So in dorsal side, okay. So they will give you MCQs like some problem here in dorsal. So go for the surface, okay. But the lateral surface in dorsal side is supplied by radial nerve, except, this is very very important, except the distal phalanges of first 3 fingers. Okay, in dorsal side, it is supplied again by median nerve. Confused? Clear, right? See, this is our palmar side. Here we have ulnar nerve. Okay, here in radial side, there is no radial nerve here. This is median nerve. All 3.5 is supplied by median nerve, and this is we have ulnar. See in dorsal side, again same ulnar nerve. 1.5 medial is by ulnar nerve, but the lateral 3.5 is by radial nerve, except distal phalanges of first 3 fingers, they are by median nerve. Okay, clear? That is a sensory supply. Very easy to remember, right? Write you here. Sensory supply, very important. Palmar side, medial 1.5 by ulnar nerve, the little finger and half of other finger. Lateral 3.5 by median nerve. Okay, it's not radial, it's median nerve. And in dorsal side, medial is again same, right? What? Medial 1.5? Sorry, here 1.5 is by ulnar. And lateral is by radial nerve, except distal phalanges of first 3 fingers. So you are clear, right? Clear about nerve supply of hand. Okay, in dorsal and ventral side. Clear. Now we will see the function of the lumbricalis muscles. Okay, and I told you ulnar nerve is known as musician nerve, and most motor supply is done by. So motor sensation nerve is, I told you main motor nerve supply of hand is ulnar. So they can ask you a different question. Main sensory supply of hand is median. Clear, right? You know, here we have median, here also we have median. So it will be more. So main sensory supply is by median and motor is by ulnar. Now we will see the functions of muscles. I told you the lumbricals, the important muscles. What is it known as? Writing muscle. Okay? Never forget, lumbrical is the writing muscle. So to remember, we know that the function of this muscle is helping in writing. Okay? How to remember the function? See, keep your hand in writing position. Okay? Keep your hand in writing position. See your phalanges, the interphalangeal joints. This is extended or flexed. Here interphalangeal joints, they are extended, right? And see metacarpal's phalangeal joint, they are flexed. So if you are confused, like in exam, lumbricals, the function of lumbrical is extension, flexion. If you are confused, keep your hand like this in writing position. See, extension of interphalangeal joint and flexion of metacarpal phalangeal joint. Clear? And these function is assisted by two other muscles. I explained dorsal interossei and palmar interossei. Okay, that is an intrinsic muscle. Okay, so writing muscle. Keep your hand in writing position. So function is extension of IP joint. IP means interphalangeal, okay? IP means interphalangeal, and flexion of metacarpophalangeal joint. Flexion of MCP. MCP means metacarpophalangeal joint. And these are assisted by, this function is assisted by dorsal interossei, that is DI, and palmar interossei. Okay? Clear? So this was the third intrinsic muscle. And now see the function of dorsal interossei and palmar interossei. So we studied intrinsic muscles, nerve supply, what is the function of dorsal interossei? Dorsal interossei muscle, okay? Dorsal interossei. No, interossei means in between, okay? The muscles what? Muscles linked here, the dorsal side, in between the digits, okay? So to remember DAB. What is that? DAB. For dorsal interossei, remember DAB. DAB means abduction of digits at MCP. Abduction of digits at metacarpophalangeal joint. Okay? See, DAB means abduction. See AB here. So it is a mnemonics. Dorsal interossei, DAB. DAB is abduction. Away, okay? Away. And for palmar interossei, remember pad. Okay? Pad. Here it will be same, adduction, okay? Adduction of digits at metacarpophalangeal joint. And other function, I told you, assist in writing for lumbricals. I told you earlier, right? So they both assist in writing. Clear? So dorsal interossei, DAB, that is abduction of fingers, and palmar interossei, pad, adduction of digits at metacarpophalangeal joint. Okay. Now we will take a short break and move to scapula humerus. Okay.